We're just going to wait and make sure we have everyone. Okay, I think we're all here. Share sound. We're going to start with the video.
My name is Dr. Mariana Israelson. I'm the Executive Director of
Can you guys hear it?
Intervention Center. I would like to thank Leadership Howard County for inviting grassroots to participate in the 2021 Caring for Our Community virtual visit. Let's start with a brief history of grassroots, which celebrated its 50th anniversary last year. Grassroots was started in 1969 by students who were attending Antioch College, which then had a satellite campus in Colombia. Colombia had opened in 1967 and began to change the face of the county, which was, for example, 92% white and 8% black then. Today, it is 53% white, 18% black, 80% Asian, and 7% Hispanic. Economic diversity has also increased, with greater wealth and greater poverty than previously. The 1960s were the height of the Durant drug epidemic among young people, and Antioch students started a volunteer-run and operated hotline to provide peer counseling for people experiencing a drug-related crisis. At the time, the county was small, just 60,000 individuals in 1970, compared to over 300,000 today, and county-provided human services were limited. Grassroots was one of the first of what became a constellation of organizations that were started as volunteer groups by civic leaders responding to the needs as they surfaced in our growing county. Most groups began in Colombia, which was denser and more diverse from the beginning. The diversity included people who were younger than the county's then population, and they were inclined to activism. Many of the pioneers and early arrivals to Colombia were attracted to Colombia because of its goals of openness to people of all races, ethnicities, and economic status. These were the people who supported grassroots in the early days and continue to do so today. Over time, grassroots became professionalized and began to attract grants and public and private funding to support the services it was providing for free to those who call or drop in its simplest office. Because grassroots was already in place and was responding to the mental health and other needs that arose, the county tapped the organization over the years to take on greater responsibility for providing crisis intervention services, including Howard County's only shelter for people who become homeless. From the beginning until now, Grassroots have served as the crisis intervention organization focused on those with a mental health, substance use disorders, and financial challenges. Today, Grassroots provides 24-hour crisis intervention services and emergency shelter for Howard County. Grassroots serves as a single point of entry to the coordinated system of homeless services for the county. It operates to the county's only emergency shelter for men, women, and families. Grassroots building on Freetown Road has been renovated to ensure maximum safety for clients and staff. Clients are also being supported in a non-congregate shelter at a local hotel with funding provided by Howard County. The cold weather shelter, which operates during the winter months and provides temporary housing when Grassroots is full, is managed by Grassroots in partnership with the faith communities. All homeless services are centered in the Housing First approach, which seeks to help households maintaining or achieve permanent housing quickly, since a safe, stable housing is an important building block to achieve other goals. Grassroots case managers work closely with the pupil personnel workers in the school system to ensure that the children living in the shelter get the support they need to be successful. In addition to its Freetown Road officers and shelter, Grassroots manages the Day Resource Center at the Leola Dorsey Community Resource Center in Jessa. The Day Resource Center provides basic services for the chronically homeless, including showers, laundry, access to case managers, as well as food and clothing. Medical service, substance use disorders treatment, and support in getting documents are also provided. Grassroots handles 100 to 300 calls to its hotline each day, providing counseling on a range of issues from substance use disorders, family conflicts, and suicide ideation, as well as a financial need for such as eviction prevention. Grassroots also partners with the police department to make mobile crisis team calls in response to community events, such as psychiatric emergencies, family crisis, and other traumatic events in the community. Grassroots provides in-person screening to adults, youth, and families dealing with substance use disorders. Most recently, Grassroots implemented a crisis stabilization program for opiate and stimulant use disorders. Individuals in need are often walking or dropping off to Grassroots 24/7 by community members who know the staff will do all they can to provide access to resources. The future, as in the past, Grassroots will continue to evolve to meet the mental health needs and provide crisis services to support Howard County communities. Thank you so much for inviting us, and it's a pleasure to be here with you.
So at this time, I wanted to introduce you guys to Dr. Mariana Israelson, who is the new executive director of Grassroots since October of 2020. So please welcome Dr. Israelson.
Good afternoon. Thank you for having me. I'm very excited to be here. I hope you enjoyed the video, and we're going to talk a little bit about Grassroots and the work that we do in the community. So we are one of the major topics and one of the major work that we do in the community is our crisis hotline. The crisis hotline is very important because this is the majority of the connection to the county, and how individuals are connected to the services are coming through the crisis hotline. Year to date, we have received 20,313 calls to our crisis hotline. And this is how individuals really connect to the services that they need to receive. Now, 13,749 of those calls came directly to our crisis phone number, which is a 410 number that we have in Howard County. And those calls are specifically related to Howard County residents. So 68% of our calls are now, we are part of the National Suicide Prevention Lifeline. So we are part now, that has transitioned to 988 phone number, which is going to be a nationally recognized phone number. We have received 2,311 calls year to date. Those calls are handled by individuals that are trained in how to address an individual who is experiencing very significant, difficult moments, symptoms of depression and suicidality. More than an assessment, it's also connected to support, connecting the individual to resources, and also deploying the mobile crisis response team to any individual. The mobile crisis team is a partnership that we have with the police department to connect individuals to a licensed clinical social worker that may be experiencing a crisis at that particular moment. The assessments is done where the individual is located. So we want to, delete any barriers, have a connection right there, complete a suicide assessment, and determine what is best for that individual at that particular time. Mariana Classes Hotline is a 211 phone number. So Grassroots is also part of 211, and we have received 2,385 calls. Most of those calls come from Central Maryland. We have many individuals for Howard County that call 211, and they're related to individuals that are in need of a specific services, assistance with gas and electric, assistance with rental assistance, or prevention for eviction, sometimes have to do with COVID, information about COVID. I have been positive, I don't know what to do next. So a lot of phone calls are related to that. And we also have after hours. We do the after hours for many of the centers in Howard County, for HoWorks, Shepherd Pratt, and other centers here that because our line is 24/7, we're able to provide support to many other agencies. Something important to say about the work that we do is how are the calls breakdown. Suicide is one of the issues that we address here at our crisis hotline. 846 interactions have been done with individuals that are having thoughts of suicide, that are having concerns and are in crisis. And 1% of those were completed a suicide assessment. This is where we deploy the mobile crisis team. A clinical social worker is completing a suicide assessment with that person, and determine from there. We normally connect individuals to care within 24 hours. We have a partnership with a center that is part of Shepherd Pratt that will have a licensed clinicians available and a psychiatrist available to see that person, or sometimes we take individuals to the hospital and other resources. Mental health issue is one of the large volume of the calls that we receive. 9,832 calls are related to mental health. These varies in degrees and also on what happens in our community. A lot of times we receive calls from a loved one, family members, very concerned. An individual is having an episode. It could be a manic episode. It could be psychosis, and they need assistance. We also receive a lot of phone calls regarding, we don't know what to do. We don't know who to call. We don't know. And there's a lot of support given. So the crisis hotline is more than just, I'm in crisis. It's a support system that is established in the community to provide care to the individuals that reside here. We have a very strong substance use disorders program here. We have received 2,128 calls and assessment. We provide assessment for any the hotlines using expert, which is a evidence-based system. And this is specifically connected to individuals that are having thoughts, that are having problems, family members call, loved ones call, and we connect those individuals to services. 75% of the individuals that receive an assessment are connected to treatment, which is a high number considering what is the national comparison for that. We have 2 peer recovery specialists and licensed social workers working with individuals to connect them to services. From there also is our 23-hour a stabilization center that we have here in-house to provide substance use disorders treatment for individuals with opioid use disorders and stimulants use disorders. We function like an emergency department specifically for substance use disorders, so individuals can walk in, can call, no barriers, no insurance. The important part is that you come in, and from here, we get them stable and connected to treatment. So our goal is connection to treatment. So from us, we do an assessment, a biopsychosocial, a medical assessment. We start individuals in buprenorphine for opioid use disorders treatment maintenance and refer to a program that will be appropriate level of care. We also receive a large number of calls of what we call our frequent callers. These are individuals in the community that are very limited interactions with others and need assistance. These are individuals that normally are seniors or are disabled or need somebody to talk to, as simple as that. And a large number of the calls that we receive is for what we call the frequent callers. And sometimes that is the only interaction they have with another person for the entire day. We are the sole point of entry for Howard County Homelessness Services, and we received 2,433 calls from individuals suffering from housing or financial crisis. A large part of these also is that we work as a food pantry for the community. So a family can call and ask us for resources, and we will provide food items for them to come to pick up. We also have gas cards items. So we have a very large food pantry here and a day resource center, and we provide, depending on the family needs, we provide anything you can possibly imagine. We also have formula, and we have many items. So when individuals call a phone number and says, I'm in crisis, our question is how we can help you, what you need, and what services we can provide. We also complete the housing assessment, which is if an individual calls the hotline and reports that they're homeless or to be at risk for homelessness, we conduct a housing assessment. Per HUD, in order for an individual to receive services in any type of shelter, they have to deem literally homeless. That means that the individual has to be living in a place that is inhabitable for human habitation. Most likely means they're living in their cars, they're living outside, and they're not in any place that they could live, have human habitation. This is very important for us. When we determine that an individual is living in those conditions, we refer them to the outreach team in the community who will verify, connect to that individual immediately, and verify that these individuals are literally homeless. Once established they're literally homeless, then they're access the shelter services that we have in our community. And we have different types of shelters in that community. We have a emergency motel shelter, a crisis motel shelter, our emergency shelter here in Grassroots, and we also have cold weather shelter, and we have co-blue as well that happens in the winter seasons. And that is kind of like a quick lookup of the calls that we receive. I would like to know if anybody has any questions before we move to other topic, trying to be mindful of everybody's time, so I'm not taking over of that. If anybody has any questions so far.
How often are your shelters filled? I work at the library. We have referred several individuals to Grassroots. And I know sometimes they do get turned away because some of my customers have histories of violence. I'm sorry. Now, Grassroots will not allow them to go there if they have a history of violence. I'm not
Correct.
sure.
So we look in the registry, and the criminal registry, and if a person has an active case or a severe history of violence, they cannot come to the shelter here in the in Freetown Row. However, they may be eligible for services at the emergency motel program and the crisis motel program, and we have those services as well.
My question is, you mentioned the being a resource for opioid addiction, for people suffering from opioid addiction, and getting them in touch with a place to go for rehabilitation for a program. So if someone comes in who is addicted or who is high, do you have the facilities for detox while they're there?
Yep, we do detoxification for opioid use disorders. We
Oh,
start.
you do? Okay,
Yep.
good to know. Thank you.
Oh, absolutely. We start detoxification as long as individuals meet criteria. You know, that you have to meet the medical criteria, but we start detoxification here. And
Okay.
then, and during that process, because what we do is start the withdrawal management here, so the person is not suffering or getting more ill while they're here with us using motivational interviewing skills. We work with them to get them to treatment. Normally people come with no intention to come to treatment. They just want to feel better. And that while we're here, we work with them and really motivate them and change them, you know, and work with them, and we do interventions, we do the whole 9 yards, and connect them to resources. And our job is to get them to the treatment providers. So we transport them or drive them or however we get, because our funding is more, so the goal is to get the person to treatment,
Right.
because that's such a hard step in substance use disorder. So that's how we get measured. So our goal in life is to get them to accept treatment, go to treatment, and then follow up.
But if someone needs intervention for someone who is an opioid user, for instance, and family calls for intervention, do you have the facilities to send someone who is trained to do an intervention? Or does it have to be someone who walks into Grassroots?
No, we can do both. However, when it comes to interventions, what we do is that our peer recovery specialist connects to the person and starts the process. Now, we do have individuals that are professional interventionists, and we connect families to that as well. Okay. But we first try very hard with our peer specialists and our licensed social workers to get the person to at least talk to us and consider treatment. It takes sometimes a couple of weeks, but we normally get there.
Thank you.
Of course. Any other questions?
Over the years, I've heard that Grassroots often has a waiting list because the services are required. There's a high demand for these. Is that still the case, especially now with COVID? And when that happens, how do you handle the requests?
So normally we do have a waiting list, that is correct. Now we do have the emergency motel program, is where we put individuals sometimes in there when we have a waiting list in the shelter, and we also have the crisis. Because of COVID, Howard County has authorized for the cold weather shelter we have 21 rooms and a hotel in the community for the entire winter season. And we also have 10 rooms, depending on the weather, selected for co-blue, where individuals go if they happens to be homeless and they need shelter during the severe storms or the weather is 26 degrees. Our waiting list is very small. Actually, Howard County is very fortunate to have resources. We currently, I believe we may have 2 or 3 people on the waiting list. It's not a very long waiting list because there are services. Now, we work in partnership with HopeWorks as well, which is specifically to domestic violence. So we kind of do what we can. COVID really limit our ability, because normally in the past we would have roommates in the rooms here. Where that we had to change. We have created a space quite drastically change it in order to make cubicles for individuals to stay there. So between the resources that we have, I think that despite the fact that we have a waiting list, it's a very small waiting list and compared to other counties.
How long are people allowed to stay in the shelter?
So that depends. The model that HUD follows is called crisis first model, in which housing first model, which means that we're working for that individual to transition to permanent housing as soon as possible. We normally have a limit of 6 months. We have had individuals that have stayed here longer, but our goal in life is to get those individuals to housing as soon as possible. So the minute they come in here, we normally work with a 90-day timeline. We're very, very focused in those 90 days to get as many things accomplished. Doesn't work all that well all the time, but sometimes we are able to accomplish that depending on how we are doing. But we, there's a limit, and we try very hard to work with individuals to get them. We apply for vouchers, we apply for everything under the sun, housing. We really work with Bridges, Humanen, and any other organization among the sun, basically, to get individuals to housing as soon as possible.
So we have about 4.5 more minutes. Any other questions?
This is Sheila. I just wanted to really commend your organization on their services. Many, many years ago, my son was much younger. I recall calling Grassroots when he was having a meltdown. I think at that point he was probably age 10 or 11. And, it was a great alternative to having to call law enforcement, which I'm not sure at that point, really was maybe had the training to work with children with autism. But it was a game changer for us and also for his behavior. I think it was just a shock that I could call someone who I could put on speaker to say they're hearing what you're saying, and didn't have any problems whatsoever. And that, like I said, that was over maybe about 70 years ago. But you all have a great service that you offer the community. I don't know how you balance all of these services and the phone calls, just everything. So you're really to be commended for the awesome work that you do.
Thank you. I really appreciate it. We sleep on Tuesdays.
I believe it.
Brandy?
Are you guys looking for volunteers? Do you guys need food? What does your organization need?
We need absolutely everything. Yay. Anything. We'll take we need food. We definitely need food. We have a large food pantry here, and we have a large pantry in the day resource centers. We need volunteers for the day resource center mostly. That's the area that we're suffering. Because of COVID, we lost 95% of our volunteers. Our volunteers were retired individuals that unfortunately are high risk for the virus. So we lost our workforce. And this is a volunteer which earns $0. So you can imagine it's not a workforce you can replace because they are volunteers. So for us right now, need for volunteers is very high. We have a volunteer coordinator named Monteith here in the office, and she will connect anyone who would like to volunteer with us immediately, especially for the day resource center. We're open 4 days a week. We do a lot of food distribution there. We have showers, we have laundry, we have education. The pandemic has impacted us drastically from a workforce perspective and from the services we provide. We used to be able to really serve about 160 people a day at the day resource center, and now we're limited to 10 inside the building at a time. It's being complicated, so we need as much assistance as possible. And I do have to recognize that Howard County community has really come through for us this season, this holiday season. We could only receive gift cards, and we received gift cards from anybody that live here. I would believe it was a very wonderful response from the community for us, because we were very concerned about what's going to happen this holiday season. We serve people inside the shelter, and we have people in hotels, and we have people in the day resource center, but we're always looking for help, always. Anytime we have children here, the pandemic has impacted our operations drastically, and it has been sad to see all the work that we used to do, especially for the children here. And so we partner with the library, for example. We got Chromebooks for the children, we got desks for the children, but you know, it is different. So we're always looking for help in any way possible.
Would you like
Thank you.
classes done at Grassroots for the children? Or would you be welcome to that, like a partnership with the library?
Absolutely, we would love to. Yes.
Are
Yeah, we would.
children, like teenagers, able to, I mean, maybe during COVID or probably post-COVID, but would they be able to help out and volunteer as well?
Post-COVID, yes, we're very mindful that, you know, we don't want to put anybody at risk, but we will take volunteers. We used to have a strong partnership with the high schools in the community, and they will come here and help and do tutoring, all of that, which has died basically until the children are welcome back in their schools. Hima, you were going to say something?
Yes, we have a family tradition to celebrate birthdays and anniversaries by bringing something over to Grassroots. And we have a birthday coming up, and normally I look on the website and see what you need and go shopping. Now we are avoiding shopping. So I was wondering if you prefer cash at this point or another form?
Gift cards are always welcome for us, or I mean, we will always take a financial donation happily, but if you want to specifically to go to the individuals, gas gift cards is something that we're always collecting because we
Welcome back. Welcome back. Welcome back. So thank you all, the presenters that took the time out of their busy afternoon to share some information with each of you in the class. So let's do the infamous Leadership Howard County round of thank you, round of appreciation. Yay! You guys are awesome. Thank you, all of you wonderful, organizations, for taking the time to be with us today. We are so grateful for your time and helping our class members better understand what services your organizations provide.
Thank you.
That we will give you permission to go back